Good evening, everyone, and thank you for joining today's webinar in preparation for our upcoming Virtual Advocacy Day on Tuesday, December 6th. I'm Dr. Stuart Abramson, and I have the honor of serving as the chair of the Advocacy Committee for the Quad AI. During tonight's webinar, we are going to hear from our partners at Heart Health Strategies, a Washington, D.C.-based government relations firm, regarding our upcoming event on December 6th. Today's speakers will be covering the logistics of our event, sharing some tips to make the most of our time with members of Congress who will speak to our group, and also we're going to review.
Folks, it looks like we're having some technical difficulties, so I'm going to go ahead and get started. My name is Matt Duckworth. I am with Heart Health Strategies. As Dr. Abramson was saying, we are a legislative and regulatory federal government consulting firm that has worked with the Academy for many years. I want to thank Dr. Abramson and the staff at Quad AI for having us this evening. I'm going to talk to you today about the logistics of our Virtual Advocacy Day coming up on December 6th. Then I'm going to provide you with some tips to make the most of our time with the members of Congress we're going to be interacting with. After that, you're going to hear from my colleagues Sue Rampton and Emily Graham, who've joined us to talk about the issue briefs, those federal priorities of the Academy that we'll be focusing on during our Advocacy Day. So let's first talk about the format that we're going to use, that we're going to interact with our speakers with on December 6th. We're going to be on the Zoom video conference platform. So the difference between right now and December 6th is that right now we're on the webinar platform for Zoom. And I think a lot of us are familiar with the differences, but it's an important distinction to make if you're not. You're able to only see and hear panelists right now, but we're going to be in the video conference platform on the 6th. So we will actually be able to see and hear everyone that joins. That includes our speakers from Congress, as well as every single attendee. Unlike an in-person advocacy day, where a smaller group meets with a member of Congress or their staff and pitches their ideas, this format's a little different, and we're going to discuss that in a few slides from now. One important thing to note, and we'll go over this again later, you're going to use the exact same Zoom video conference link for every single speaker throughout the day on December 6th. It's very easy to log in and out, but you'll use that exact same link. That being said, we have included some flexibility in the scheduling because it is on a virtual platform, but please do your very best to attend all of our speakers if possible, if not as many of our congressional speakers that we've lined up that work with your schedule. The last thing that we want that day is to have an empty Zoom room with a member of Congress speaking to the Academy, because it's a reflection on us. You're going to receive that Zoom link that we'll be using all day on December 6th later this week, along with a recording of this webinar and the final issue briefs that my colleagues are going to discuss here in a few minutes. Let's talk a little bit about the run of show for each one of our speakers that we're going to hear from next week. First, I'm going to introduce the member of Congress for one quick minute before we hear from them. I'm going to give you a little bit of information on their background, any committees of jurisdiction that are important for you to know, and any pieces of legislation that they've either taken the lead on as a sponsor of that legislation or that they have supported or co-sponsored. Next, we're going to hear the member of Congress provide some remarks. Those remarks could be 1 or 2 minutes and very casual or formal, or they could be up to 5 or 10 minutes. It's really up to the discretion of the lawmaker. After we hear those remarks, I'm going to open up a moderated question and answer session. We're going to go over the details of that in a moment, but you're going to have the opportunity to ask questions directly of members of Congress that are joining us. Finally, I will conclude the moderated Q&A. We won't go over 25 minutes with any speaker because we have about a 30-minute time slot carved out with each of them. Now that we've seen the run of show, I want to go back to Zoom. I think, again, we're all fairly well acquainted with the Zoom platform, but I want to take a quick tour and highlight some things that'll help us for next week. So here's an example of the Zoom screen that we'll have the day of. One thing to note, and you'll see in the bottom left corner of my screen, my name is there. When you log in that day, we want your full name spelled out for your displayed username. A lot of you, if you're using different computers or iPads or logging in on the Zoom app on your iPhone, might have just your first name, or it might just say iPhone, for instance. If you see that when you log in, we want to make sure that we put our name up there because it's important to our speakers that they know who they're talking to. Even more importantly, if we don't recognize your name, we may need to remove you from the Zoom room as this is an invitation-only event and we don't want to do that at all. Probably the most important thing on this entire Zoom screen for next week is that mute button. We're going to have a large number of people, and we've all been on video conference calls over the last few years where someone accidentally leaves the mute button off and then they have background noise. That's a huge interruption for our speaker. And while we'll do our best to police that, it's most helpful to have you police that yourself and make sure that you're on mute. You will be muted upon entry into the Zoom room. So if you do need to unmute for any reason, please note that you will be muted to begin with. If you're not speaking though, you should be on mute. For the question and answer session with members of Congress, what we're going to do is utilize the chat function, which is in the bottom middle of your Zoom screen. And it may feel repetitive, but I'm going to be providing a reminder of the mute button and of the process by which we use the chat function for our Q&A for every single speaker that we talk to. You're going to hear it a lot if you stick with us all day that day, which I hope you do. But it's important to know, and it'll make things easier, especially for our speakers as they join us. When you click on that chat function, you'll see a box pop up and you can go to the to field. Right now you see it says everyone. You'll use that as a drop down. You'll click my name, Matt Duckworth, and I'm going to ask you, and remember, I'm going to go over this every time. I'm going to ask you to send me your full name, your home state, and the full question that you want to ask the member of Congress. Once I receive that info, what I'm going to do is put you into a queue with others that have sent a question in, and I'm going to call on you individually to actually unmute your line and speak directly to the member of Congress to ask them a question. If you're from the home state that the member of Congress is from, you'll get moved up to the front of the queue, which is really important of why I ask that. One important note, and it's easier for me to moderate the Q&A, please send me that full information every time you send me a question. A lot of people ask a question on the first speaker and then they just send me their question instead of their name and their home state on the next speaker. It makes the Q&A flow a lot more smoothly if you send me all that information with every question you have. Again, I'm going to be repeating these instructions. If you leave this webinar without listening to anything else, I want you to hear this. Please review your issue briefs that my colleagues are going to go over, that the Academy staff is going to send you later this week. Please review those issue briefs and come with some prepared questions. We'll talk a little bit more about how to prepare those and how they should sound, but please do a tiny bit of homework ahead of time, and it'll go a long way to having some really meaningful interactions with these members of Congress. Finally, one quick note on chat etiquette in Zoom. You'll see right now that Zoom box says everyone in the to field. You have the option of sending that chat to everyone or a direct message to an individual participant. If you have something that you want to share with an individual participant, feel free to send them an individual chat, but please don't engage in any public crosstalk. It can be very rude to our speakers as they're trying to provide remarks to us and spending their time with us. And it's not really a town hall format, so it can be a big interruption. Let's take a brief look at kind of the schedule from a 30,000-foot perspective for December 6th. At 10 a.m. Eastern time, our first congressional speakers will start off. Now, there is an asterisk there and at 1 p.m., and I'll explain that. Right now, our first speaker starts at 10:30 a.m. I'm hoping we are able to fill almost every spot that day, which we'll go over in a moment, but 10 a.m. is the earliest time, 10 a.m. Eastern time, that we'll start with speakers. Currently, 1 p.m. is our break for lunch. Again, there's an asterisk there too, because if I can fill speakers in every single 30-minute time slot throughout the day, I'm going to do that. If you need to go off camera and eat lunch, that's okay. But I'm going to power through and get as many members of Congress on our schedule as we can as possible that day. So right now, 1 p.m. is our break for lunch. That could change. We'll keep you updated on that schedule. No later than 3:30 p.m. Eastern, congressional meetings, speakers will conclude. So our last speaker will begin at 3:00 p.m. Eastern at the very latest. We've invited, just to give you a sense of who to expect, we've invited bipartisan members from the House Energy and Commerce Committee, the House Ways and Means Committee, and the Senate Finance Committee. These are the major healthcare committees to the issues that we want to speak to members of Congress about. We've also invited members of Congress who have introduced legislation. They're the sponsors of legislation. that the Academy is either tracking or they're officially supporting. So different topics than just those that are on the healthcare committees might handle, but things that the Academy is interested in. As the schedule gets closer to being finalized, again, we'll provide you with a list of those speakers and some times. We've got approximately 9 time slots available throughout the day. It's my estimation that we'll confirm somewhere around 6 to 7 members of Congress to speak, but we're hoping to push that number as high as possible to give you as much time with lawmakers as we can. One note, the list, whenever you receive it at any time, is fluid. Members of Congress are having their schedules changed at all times, day and night. So even the day of, we might have some changes. We'll make sure that to continue communication with you throughout the day and that you know when to expect which member of Congress. Winding down here a little bit, I want to talk about the goals of our meetings with each member of Congress. The first is to be informed. We always think about advocacy, we think about informing members of Congress, but I think it's important in this format especially to know that we're listening to members of Congress. They're going to be able to tell us, because of their unique perspective, what to expect and how to be effective in our advocacy. They're insiders, they're the actors, they're the ones that go and vote on the House and Senate floor. So we can glean some really valuable intelligence from them. We want to educate. We want to provide on-the-ground information from the front lines that members of Congress simply can't receive without you telling them. My colleagues are going to brief you in a moment on the issues that the Academy is prioritizing. And I mentioned this earlier, but there's some key differences between our virtual format and an in-person meeting on Capitol Hill that some of you may have previously participated in. For this format, we're hearing from members of Congress and then asking questions that are focused on our priority issues. Instead of making a traditional pitch, we'll have to be kind of thoughtful about how we approach the Q&A and try to emphasize our issues within our questions. This means that you need to educate members of Congress by providing examples within your questions of why these issues are so important. Finally, you want to build relationships, and part of that is making sure we have a big group show up to each speaker and have some good questions prepared, but make that positive impression to where the lawmakers feel like the Academy is a trusted resource. And then in the future, they may reach out to us proactively because they've heard your expertise and understand your frontline experience. A couple of tips for success: arrive early, but not too early. 5 minutes early is plenty. Again, mute your audio, very important on our video conference platform. Be prepared. Come prepared with those questions. Be ready to actively participate. We want everybody asking questions during the Q&A, not a small handful of folks. Be on camera, show your face. Members of Congress want to talk to you and interact with you. For your questions, it's important within your preparation to stick to our advocacy priorities and other relevant questions. We really want to stick to the issues at hand, and that focus can help create some momentum we need for the end of the year here as we come to the end of the 117th Congress. Again, a copy of the issue briefs are going to be sent to you in advance. Please review these. Members of Congress are also going to receive a copy of these issue briefs. So when they prepare their remarks, they're going to have a good idea of what it is, one, that you want to hear about, and two, what questions you may have for them. Finally, the Jeopardy rule. And this is something I made up for this format on the video conference because it is kind of strange to be asking questions and making a pitch at the same time. Be sure to always phrase any statement you're trying to make in the form of a question, right? Just like Jeopardy, answer in the form of a question. The quickest way that we can lose a member of Congress and their attention is for them to feel like they're being lectured to. So really be creative in the way that you phrase those questions, prepare, and come ready to talk. Thank you so much. I am happy to answer some questions after we hear from my colleagues, Emily Graham and Sue Ramthan. They're going to provide an overview of the issue briefs now, but I appreciate the opportunity to be with you this evening and looking forward to next week. Emily?
Thanks, Matt. Hi, everyone. Emily Graham, Vice President of Regulatory Affairs here at Heart Health Strategies. I think our first topic this evening is going to be on the Medicare reimbursement cuts. Next slide, please. So the Medicare reimbursement cuts are definitely a big issue for Academy members, not just because Medicare is probably one of the payers that you deal with pretty often, but also because of the impact that Medicare reimbursement rates have on private payers. And as all of you know, when the CMS, the Centers for Medicare and Medicaid Services, released their final rule for calendar year 2023 payments, They finalized a conversion factor of $33.0607. This is a reduction of 4.47%. You're down about $1.55 from the current year 2022 conversion factor. And you're probably wondering why your reimbursement is going down. Well, there are a couple of key factors that are specific to this reimbursement cut. The first is that as part of the Medicare Access and CHIP Reauthorization Act, which was enacted in 2015, which is what changed the payment formula from the former sustainable growth rate formula, we negotiated a series of modest updates as well as flat updates to allow for practices to get adjusted to the quality payment program with, again, modest updates in the out years starting in 2026. And right now we are in that 0% update. This is particularly problematic because another challenge with the Medicare physician payment system is that we no longer have an inflation adjustment. That went away when the SGR went away. In addition, we are facing a sizable budget neutrality adjustment of 1.6%. This is in large part due to the fact that CMS, similar to what it did in calendar year 2021, when they updated the office and outpatient evaluation and management services, they've gone back and looked at all the other E&M services. So for example, inpatient hospital, subsequent hospital, nursing facility, E&M visits, all of those services were not updated in 2021. And so they needed to be updated now. And so as a result of the changes that were made to the work RVUs for those services, we are facing another budget neutrality adjustment, not quite as large as what we were looking at in 2021, but still this is pretty substantial of a budget neutrality adjustment. And then last but not least, because of the E&M adjustments that were made in 2021, we are still basically paying back that steep cut that we were facing. And over the past couple of years, Congress has mitigated some of the reductions that we have faced, most recently through the Protecting Medicare and American Farmers from Sequester Cuts Act. Congress provided us a 3% update, which partially filled the hole from 2022. And so cumulatively, we are now facing a 4.4% reduction in 2023. For your specialty in particular, your pool of dollars is looking at a loss of about 2%. And most of this has to do with changes to practice expense, which I'll talk about in just a moment. Next slide, please. So I mentioned that practice expense was a big part of the reduction to the allergy immunology pool. And a lot of that has to do with clinical labor pricing. So last year, as part of the CY 2022 physician fee schedule, CMS made some changes with respect to the data inputs that it uses to compensate you for your clinical labor costs or your clinical labor wage, salaries, et cetera, because that's all built into the practice expense component of the physician fee schedule. And one of the things that CMS did is after a 20-year lag, they updated those clinical labor wages. And when you think about how much wages would have increased over a 20-year period, coupled with the fact that we are in a period of high inflation and working within a budget neutral system, that prompted some pretty significant swings in reimbursement. Because there were some pretty drastic reductions at a code level basis, including for drug administration services. So for those of you that are delivering any medications in your practices, you're definitely feeling the squeeze because of the clinical labor pricing updates. CMS did at least agree to phase in those data inputs over a 4-year period. So it would kind of soften the blow, but we are now in year 2. So, you're cumulatively facing some cuts when it comes to your practice expenses. And then another big issue that clinicians are facing right now relates to sequestration. During the COVID-19 public health emergency, for part of the time, Congress gave us some reprieve by putting a hold, if you will, on the Medicare sequester, which was 2%. But unfortunately, they did not allow that to continue as a moratorium, and they have reinstated the Medicare sequester that went into effect July 1st of 2022. So we are under the Medicare sequester, so you are being reduced by 2% there. And then as a result of the passage of the American Rescue Plan, that triggered what is known as the PAYGO sequester. Fortunately for us, this PAYGO sequester affects a number of other industries, such as defense. And so because there are so many other sectors within the budget that are facing the same cuts and fighting against this, Congress has not allowed these cuts to be implemented, although that remains to be seen. And if it were to happen, the cut would be 4% for Medicare. Next slide, please. So I kind of talked about what's happening for 2023, but all you have to do is take a look at this really amazing graph that the American Medical Association put together that shows how bad it really is for physicians, particularly when you look at all of the other Medicare providers, such as hospital outpatient departments, hospital inpatients, skilled nursing facilities. All of those providers are receiving updates year after year. And also you can see in this chart that the Consumer Price Index, which is the index that's used for most of those providers to receive their payment update, as well as the Medicare Economic Index, which is the inflation update that we still use in some parts of the fee schedule, but it's not used on the whole to update our conversion factor. And you can see here that practice costs are going up, consumer prices are going up. All of the different providers that are paid under Medicare are getting a pay bump, except for physicians. We have been stagnant, quite frankly, for more than 30 years now. This just shows for the past 20 years. But this is a significant problem with the Medicare reimbursement system. We definitely need to have an inflation adjuster. There's a couple of other changes that we probably need as well. And we can talk about those at another time, or you can listen to the Medicare payment webinar that we put together about a month ago to get a little bit more information about this. But there are definitely some long-term fixes that need to happen when it comes to the Medicare payment formula. But right now we're focused on 2023 cuts. Matt, next slide, please. And so what we are asking Congress to do is to act before the end of the year to avert the upcoming reimbursement cuts that are going to take effect on January 1st. And they can do this by passing HR 8800, which is the Supporting Medicare Providers Act of 2022. This would provide, I believe it's a 4.42% update to the conversion factor, which would at least almost entirely mitigate the cut. Of course, that doesn't provide us a positive payment update, but at least it would prevent the steep cut that we're facing right now. And then, of course, as I mentioned, there's a number of other issues related to the Medicare physician fee schedule, such as the fact that we don't have an inflation adjuster, that there are very little adjustments that can be made by the secretary with respect to budget neutrality, and a number of other issues. And so we are asking lawmakers to work with the physician community on substantive legislative reforms to Medicare physician payment. All right, I will turn it over to Sue for the next issue brief.
Thanks, Emily. So the Academy has actively supported several bills introduced in Congress to reform the prior authorization process. Next slide, Matt. You likely know from personal experience that health plans are imposing prior authorization more frequently. Many times those requests are ultimately approved, but the process is long and it's costly. And there's no standard electronic process that requires more of your time and effort and those in your practice. In fact, practices a report that dealing with 40 prior authorization requests each week, amounting to 2 full days essentially away from patients. So many states have passed utilization management laws at the state level, but those laws do not address Medicare plans. Those are under federal jurisdiction and therefore require federal action. The Academy is supporting 3 prior authorization reform bills. I'm sorry, Matt, please advance. So the Improving Seniors Timely Access to Care Act is the first one. This is a comprehensive bill that seeks to streamline the prior authorization process in Medicare Advantage plans. It passed the House of Representatives already, and it's now awaiting action by the Senate before it can be signed into law. The second is the Gold Card Act. This legislation is modeled after a Texas law, and it would exempt providers from prior authorization requirements under the Medicare Advantage plans if they had a 90% approval rate of prior authorization requests during the previous year. And then the third is the Medicare and You Handbook Improvement Act. This legislation was recently introduced in the Senate and previously introduced in the House. It seeks to include utilization management information in the Medicare Handbook to help beneficiaries choose a Medicare plan or fee-for-service. So each of these bills is bipartisan. The bill numbers, I know there's a lot of them there, so I didn't bother to mention them right now, but they are in your issue briefs. And you've got the HR numbers for the House and the S for the Senate. So you'll see that the first and the third bill there have been introduced in both the House and the Senate. The Gold Card Act right now is only introduced in the House. Next slide, please. So as you're talking with your legislators on December 6th, our request is for Congress to advance these bills before the end of the year. As previously mentioned, the House had already passed the Improving Seniors Timely Access to Care Act, and so far all of the members you'll be speaking with on December 6th were co-sponsors of that bill. However, even though they've supported the bill and voted for it, we still will need their support to include the bill in an end-of-year package to see it actually become law yet this year. Next slide, please. So the Academy has also been active on a number of bills to advance health equity and expand access to care. So I'll quickly discuss several bills that are related to telehealth. Next slide, please. Medical nutrition, air quality, and clinical trials. As mentioned, the issue briefs are going to provide more information, all the bill numbers on these. So please feel free to review that before December 6th. Next slide. So the first bill is about telehealth, and to avoid a disruption in care once the COVID-19 public health emergency ends, the Advancing Telehealth Beyond COVID-19 Act would ensure that the current telehealth flexibilities continue through 2024. The House already passed this legislation with overwhelming bipartisan support, but the Senate still needs to act before it can become law. So as Matt mentioned earlier, in thinking about framing your questions for legislators, one thing that in talking to members of Congress that would be helpful to them is they would like to hear examples of how telehealth flexibilities have been cost-effective and improved patient care. So the Congressional Budget Office, which prepares the cost estimates for legislation, is telling Congress that telehealth is an additive benefit rather than replacing services. It's adding to them. The cost of the legislation is a determinant in how long Congress can extend these flexibilities. They have to pay for them. Many members of Congress would actually like to see a permanent extension. So as Congress is considering how to pay for an extension of the telehealth flexibilities, they're looking to understand how telehealth is being used now and if it can produce savings for the healthcare system due to increased efficiency and improve access for patients. So that's one area where you might be able to think of some recent examples and weave those into a question. And I'll just throw out an example. The question could be, what else could we be doing to help get this over the finish line? Or, what are their predictions for could this, how long do we think we could get it extended? Another bill, the second one there, is a bipartisan bill supported by the Academy and patient groups, the Medical Nutrition Equity Act. This bill would require coverage of medically necessary nutrition, including vitamins and amino acids, to prevent adverse health outcomes. In the bill language, covered diseases do include IgE allergies to food proteins. And then the third bill is the Public Health Air Quality Act. This promotes more monitoring for pollutants that are contributing to poor health outcomes including asthma across vulnerable populations. And the last bill on that slide is the Diverse Trials Act, which would increase diversity in clinical trials by requiring the Food and Drug Administration to publish guidance on decentralized clinical trials, as well as require the Department of Health and Human Services to support community education, outreach, and recruitment. The lead Republican on that bill is Congressman Larry Bucshon, who's a physician, and he will be meeting with you on December 6th. The Academy's issue briefs are being shared with the members, as Matt mentioned, in advance of the Virtual Advocacy Day. So your ask of the members of Congress is that they advance these important bills before the end of the year. I will turn it back to Matt now, who will moderate Q&A.
Thank you, Sue, and thank you, Emily. If anyone has questions, you can navigate to the Q&A box. And you can send us a question. It can be about logistics for the day, the speakers that we're going to hear from, or some questions that are more specific to the issues that we're going to discuss with members of Congress. I'm not seeing any yet in the Q&A, and I'm also going to check the chat.
So Matt, I have a few questions from Sheila. Would you like me to read these?
Please go ahead, Dr. Abramson.
If my member of Congress isn't on our program, can the QII help me reach out to him or her separately?
That's a great question. If your member of Congress isn't on the program, and the odds are they won't necessarily be, there's 435 members of the House of Representatives and 100 senators. You have 2 senators that represent you and 1 member of the House. We can certainly help you with contact information, especially for the healthcare staffer in your member of Congress's office. And you can use that to reach out to them and share the issue briefs. Make contact with that office. Let them know that you can be a resource to them in the future. That's a great question.
Another one. I really want to talk to members of Congress about another issue. Can I bring up something else during the discussion?
Very good question, and I'm glad I already covered this one. This is important that we stick to the issues that are outlined in the issue briefs. I think getting a member of Congress's contact information and their staff's information is a valuable time to follow up. This is an event that is hosted by the Academy, so we're going to be focused on the priorities of the Academy. It's a very important time right now in the 117th Congress, which ran from the beginning of 2021 until the end of this year. If the bills that we're supportive of right now don't get passed by both the House and the Senate and sent to the President's desk, in January, when the 118th Congress begins, we have to start all over. So this is an important time to really laser focus on these issues and try and get them across the finish line. Again, we can provide contact information as needed to your member of Congress, but we'll want to stick to the issues on the Academy's priority list right now for this event.
And one more. I know my state representative and state senator in our state legislature. Does it help to reach out to them as well?
Absolutely, and such a good question, right? All politics is local is one of the best phrases we use all the time when talking about advocacy. And while federal advocacy is incredibly important, especially on issues that have federal jurisdiction, there are a number of issues on the state level that are very valuable for you to advocate on for your patients and your practices. If you are able to connect with your state and local officials, it's always a good idea. But again, it just depends on the issue, right? Because some of these issues are going to be in federal jurisdiction and some are on the state level. I've got a question that I'm going to answer now from Dr. Khan, who's joining us tonight. And it's a very good one. He's asking, is it a good idea to tell a patient story to frame the question? That is an excellent idea. When you're talking to lawmakers about healthcare issues, what they really want to hear of is how the patient is affected by the problem that you're presenting to them. At the end of the day, you all, members of Congress, are all on the same team in terms of wanting to help patients. So framing your question with a patient story at the center of your question is a really good way, not only to get their attention, but to have these members of Congress remember the question that you've asked and recount the issue later on. It tends to sit with members of Congress better, and it really resonates with them well. Thank you, Dr. Khan. And then I saw another question in the Q&A about, it was similar to the one that Dr. Abramson had asked about, is it okay to ask questions to members of Congress that are related to allergy and immunology, but not mentioned in the issue brief? I'd say the same answer for that question as the previous one. Although there are important issues outside of those that we're going to be discussing, it's very important to focus solely on the issues that are outlined in your issue briefs because of what I outlined with the timing involved with the Quad AI's priorities right now. So you'll want to focus on those issues. And again, if you need contact information for your member of Congress's office, you can reach out to the Academy staff. We're happy to provide that so you can connect on those other issues outside of an official Academy event. And it looks like we've got another question in the Q&A from Dr. Kabash from Boston. How important is it for us to have questions as opposed to listening to the member of Congress? Such a great question. And what we want to do is have a balance here, right? I mentioned earlier that when you have members of Congress come and give you and provide remarks, they're going to understand what issues are important to you in advance because we're providing those issue briefs to them. That being said, it's a two-way street in terms of the Q&A because not only are we asking them to become champions of these issues if they're not already, but we want to ask them, like Sue said, what do you think about the odds of this happening? How long are these telehealth extensions going to be that are signed into law in the end? You have an opportunity to gain intelligence from them. And if you give some certain open-ended questions like that, you might end up learning something that we didn't even know we needed to ask because there's lots of moving parts in this end-of-year legislative package that are happening right now. Sue, did you have anything to add to that?
Yeah, I would just add, they will start out by speaking. So they will have their opportunity to speak as long as they want. They're not going to fill the whole amount of time. So it's important to engage. That's memorable for them. It's more enjoyable for them. So by having questions that you have ready to, engage with them on, will just make it more memorable and more valuable to both sides, really.
And I think this brings up another strategy that we often talk about in in-person meetings where the group is smaller, but I think can really be effective in the Q&A. If if you see the member of Congress and their name on the schedule, you look at their website, you see their background. If there's something that you have in common with that member of Congress and you're going to ask a question, when you're introducing yourself, bring that up. Did you go to the same undergrad? Did you go to the same medical school? Things like that really resonate and can make for a very nice conversation with the member of Congress that makes it a memorable one for them, which is the goal here, right? Build those relationships.
I guess one more thing to add. I mean, part of your advocacy is to be seen as an expert in your field and a resource to these offices. So the bulk of the folks speaking to you are members of Congress who are actively engaged in healthcare issues. You want them to remember you, reach out when they're working on legislation and come back to you. And that's where the patient examples and engaging with them is very important for building the long-term relationship.
Thanks, Sue. I'm not seeing any other questions in the Q&A, so I think we're going to wind down here. On behalf of my colleagues at Heart Health Strategies, I want to thank Dr. Abramson and the staff from the Academy for allowing us to work with you again on this Virtual Advocacy Day this year and talk to you this evening. We're really excited for December 6th. With that, I'll turn it over to Dr. Abramson for some closing thoughts.
Thank you very much, Matt. I'm looking forward to having everyone that's on the call tonight participate, and hopefully more people that will be able to see this that couldn't make it tonight. I think we have, well, the last count I saw was at least 80 people signed up, and I know we're shooting for over 100, 125. I'm not sure if Sheila was able to connect with us this evening. Is Sheila available, or did she not Okay. So I was thinking, Matt, also, you mentioned about connections. Is there a way you could send us a brief bio of the legislators that are going to be participating? So we might have just some additional information.
Absolutely. What we can do is when you get the list of speakers, we'll hyperlink their bio from their website, so you have their official bio. And you can review not only their background and their education, but also you can review the committees of jurisdiction that they're on, or any issues that they might bring up in the healthcare space on their website.
Thank you. And I would encourage anyone listening, if you have other questions that you didn't think of tonight but would like to get answers to, if you can send them to Sheila or myself, we'll be happy to ask Matt and Sue and Emily, depending on what the questions are, and who, maybe all of them would like to respond. But they've been a tremendous help. I do thank you all very much, Matt, Sue, and Emily, for participating and helping to organize this session. Sheila did connect by email there. advocacy@quadai.org is the email address to send those additional questions that you may have. With that, if there's anything else anyone wanted to say on our panel, otherwise, we'll conclude. Thank you very much. We look forward to December 6th. Good night.